Hello, my name's Colette Scully and I'm one of the respiratory nurses from Airedale Hospital. Today I'm going to talk to you about your medication that you may take for your respiratory condition. So we're going to concentrate today on the different kind of inhalers, how they work and the importance of them. One of the inhalers that a lot of people will have is a reliever inhaler, and this is usually blue and known as salbutamol or Ventolin. This medication is used to open up the airways by relaxing the muscles, and it usually looks like this, but obviously yours would be blue. So normally people might take this as and when they need it to relieve their breathlessness, or alternatively some people may take it on a regular basis. It usually works within 2 to 5 minutes and can last up to between 4 and 6 hours. To take this kind of inhaler, you would shake the device like this, and then we always recommend any device like this should be taken with a spacer. So you'd pop the device into the spacer, open the end. Always breathe out before you take any inhaler, and then I'm going to squirt once into the chamber and take one long breath in. You may or may not have noticed that when I pressed it down, I didn't automatically take a breath. You've actually got a few seconds where the medication will stay in the chamber. If you find it more difficult to just take that one long breath in, you can do what we call tidal breathing. So that's 1 squirt down and 5 gentle breaths in and out. The spacer shouldn't make a noise. If it sounds like this, you're breathing it in too hard. You just need to settle your breathing down and just breathe it in more gently. Okay. The salbutamol inhaler can be taken on a day-to-day basis, or some people when they're more unwell. So if you're having a bad day or you've got a chest infection or an exacerbation, you may decide to take more of the blue inhaler. The side effects to taking more of the blue inhaler are that sometimes you might find that you have a little bit of a shake in your hands, and sometimes you might feel that your heart races a little bit. This is quite normal, and this is just a known side effect of that drug. The next set of inhalers that people will be on will be called preventer inhalers, and this is something that people take either once a day or twice a day, every day. So these come in a variety of different inhalers, and all of you listening to this may have a different one. The GP will prescribe it, and sometimes it's got 2 ingredients in and sometimes it's got 3. These ingredients will also, a bit like the salbutamol, they'll smooth the muscles in the airways and open them up for you. If your inhaler is a dry powder, this needs a really hard and fast breath to take in. So one example I've got here is one of the Ellipta inhalers, and this is a dry powdered inhaler. So when you take this device, because it's a dry powder, I will need to breathe in hard and fast. So I open the inhaler up until it clicks. Again, like the blue inhaler, empty my breath, and then hard and fast and hold my breath. And that's how you would take a powdered inhaler, that hard and fast breath. If your preventer inhaler is like the blue one and it's a pump spray, that's again when we would advise that you use it with the spacer device for the same reason as I gave earlier, that you actually get 30% more drug into the lung, which is quite a substantial amount. The spacer device should be washed once a month to keep it nice and clean. So the end will come off, hot soapy water, and just leave it to drip dry on the draining board. Some of you may be on an inhaler that actually takes a capsule in. So actually the capsule is classed as a dry powdered inhaler again, so it's similar to the technique of what I've just shown you, where you would take a really hard and fast breath in, and the good thing about the capsules is that you can actually see if you've managed to empty them, so you can tell if you've taken a hard enough breath. If your preventer inhaler has got a steroid in it, so some examples of this are Foster or Duoresp. If you're on something with a steroid in, we always recommend that you should rinse your mouth out after you've taken it and have a gargle. Just prevents getting a sore throat and a bit of a hoarse voice. Another alternative inhaler that you may be on is a mist inhaler. And this is an air opener again, smoothing the muscles, and it's something that's taken 2 puffs once a day. So different to the dry powder with the hard and fast breath, and different to the pump spray as well. Like I said, this is a mist. So with this one, you twist it round and open the lid, and then I'll just show you what comes out, and you can see it's a fine mist spray. So how you would take this is you twist it round, bring it round, take the lid off. You've got 2 little grooves there. When you pop your mouth on, make sure the grooves aren't covered. And then what I'm going to do is I'm going to breathe in slowly, press the button and continue to breathe. Because if I don't do that and I press the button and breathe hard, it will make me cough. So empty my breath, breathe in. And then just breathe normally. And just finally, some patients may be on a nebulizer machine. If that's been provided by the hospital, it'll have a contact number on that you should ring every year to get it serviced, and also to make sure that you get the consumables replaced. That's the tubing and mask. It's really important that is done on a yearly basis. And you should use that as directed by your consultant or your GP. If you feel that you're needing to use it more, it may be that you are having an exacerbation or a flare-up, and that's when I would suggest that you contact your GP. Thank you for listening. Bye.